Hello, this is Dr. Gay from First Look MRI, and this is a patient who is 40 years old. She complains of abdominal pain, nausea, bloating. Symptoms seem to be worse after meals, and she's had the symptoms for quite some time, I think a couple of years, and she called to order an MRI, and I just happened to pick up the phone and talk to her and learned about her symptoms. But she said she'd been to a couple or a few doctors, and they were unable to figure out what was going on. She was really frustrated because her symptoms were very significant. They could never figure out what was going on. They had done, I think, CT scans of the abdomen, done ultrasounds and other lab tests, and everything is coming up normal. She just had an ultrasound of her gallbladder that was read as totally normal, and the doctor decided to ask her to get an MRI scan of the gallbladder as well, get an MRCP, just to make sure that the ultrasound didn't miss something, even though it was normal. And so listening to her symptoms, I decided that maybe rather than just an MRCP, which would probably be normal if the gallbladder ultrasound was normal, it'd be a waste of her money just to do an abdomen, a whole abdomen, and then also look at the aorta too, just in case, because some things there can cause problems with the GI system. So this is a case. She has some kind of confusing findings here. Her CBD was upper limits of normal, about 5.5 millimeters. Her intrahepatic biliary tree looked fine. Her liver was generous in size. You can see here the left lobe is pretty big, right lobe generous in size, but otherwise normal. No hepatic mass and no lesion. And we can see the gallbladder here looking normal. In the left abdomen, on one of these views here, we see something strange here. It looks like there may be an intussusception. Looks like a bowel loop comes down, and it looks like it widens up here into an intussusception possibly. Pretty hard to call on this, but you can see it narrow here, maybe widening here and here. So we look on our axial images. I'll slice down here and put on this slice right there. And the axial images also look like an intussusception. If we go up, here's the small bowel loop coming down. We go down, down, down. Looks like the ring there, and then it comes back to a normal morphology. So it looks like a short segment intussusception there, and it doesn't seem like enough to cause her symptoms. Her proximal duodenum here is non-dilated, but now we're going to look at the SMA, because a low SMA angle can cause SMA syndrome, and it could cause the symptoms exactly like she described on the phone. And so this is the duodenum here coming through, goes across in front of the aorta. And here's the duodenum over here, and it looks really flat, like a little ribbon here. And we did some additional sagittal T280 images to check this SMA angle. Here's aorta, SMA. Now we're going to put up a sagittal view. And here it is. So this is the abdominal aorta coming down. You see like trunk here coming across a little bit less than 90 degrees, but plenty normal. And this is the SMA coming down here, and this is nearly vertical, so very, very steep SMA. And normally this should be about 17 degrees or higher coming across. When it comes out and goes straight down like this, this is what we call a low SMA angle. Anything less than, roughly 17 to 20 degrees is considered low. This one is only 5 degrees. And when it's low like that, you can get pinching of the left renal vein as it courses between here. That's called Nutcracker syndrome. And also you can get flattening compression of the duodenal C loop, and that'll cause symptoms just like she has. And this is a tough diagnosis, and a clinical component is super important. You can see this pretty commonly without any symptoms related to it, so it may be a normal finding. But in this case, with her symptoms and the frustration of not being able to figure it out, I believe this may be a case of the SMA syndrome. The proximal duodenum was not dilated. Sometimes patients can have dilatation. If you have that, then you can be really confident. So in this case, we could do a GI exam and to see this cutoff sign. You get a vertical band to cut off as it courses over here. That may be able to help cinch the diagnosis. Just incidentally, one of an MRI tech friend of mine had this, a very similar sort of a thing. We had symptoms, could never figure it out, and we did a CT scan and found this, and she had surgery, and miraculously she got better. They cut the duodenum and moved it on the outside of the SMA, and her symptoms resolved, and now she's doing great. But she had a long, frustrating course of trying to figure that out as well. So kind of a rare, interesting case of potentially SMA syndrome and what looks to be an intussusception, which may be contributing to her symptoms. And that's it. Thank you very much.